Good morning. Today we'll be discussing on the topic of syphilis. So, brief introductions. Syphilis is a chronic systemic disease caused by Treponema pallidum, a motile spirochete. It is mainly transmitted by direct contact with an infectious lesion and enters the host through the breaches in the squamous or columnar epithelium, usually during sex. Let's move on to the bacteriology. The genus, let's discuss the genus and species. So, the genus of Treponema pallidum is Treponema, and the species is pallidum, and it is abbreviated as TP. It is a spirochete. So, a spirochete is basically an organism that has a spiral shape. As you can see in this picture, this is a picture of the Treponema pallidum. It's a gram-negative bacteria. It contains endoflagellum. So, endoflagella is basically the flagella. It is contained within the organism inside its periplasm. So if this is your organism, and so these are your flagella and they are contained within its body. This enables it to move. Incubation period is 3 weeks. However, in a few textbooks it claims to have incubation period of 7 to 10 weeks. It uses humans as its reservoir, as it is an obligate parasite, meaning it cannot survive outside the human body. Let's discuss the mode of transmission. There are three basic modes of transmission. The first is your sexual contact. Second one is your direct contact. That is by either by touching someone's skin when you are infected with the syphilis bacteria, or it's either by blood transfusion. So in the sexual and indirect contact, you will have the formation of something known as a canker ulcer. These are painless pustules that are fluid filled, and in this fluid you will have your spirochete, your Treponema pallidum bacteria contained within. However, when you get syphilis through blood transfusion, you will not have the formation of these canker ulcers uh, because the bacteria did not touch your skin. It went directly into your bloodstream. There are basically four basic phases of diseases. We have the primary phase, we have the secondary phase, we have the latent phase. Latent phase is divided into two more phases, which is your early and your late latent phase and your tertiary phase. Let's discuss the primary phase. So a primary phase begins through your mode of transmission, that was either sexual contact, physical, or your blood transfusion. So through your transmission contact, the spirochete will enter your skin, and I have said the spirochete will destroy the skin endothelium, leading to canker ulcers. Also, when the spirochete enters your skin, it will infect the local lymph nodes of that area, causing localized lymphadenopathy. As we have discussed, the incubation period is mostly 3 weeks for the syphilis bacteria. Therefore, these canker ulcers and localized lymphadenopathy will show up after 3 weeks from the date of initial infection. Then we will have your secondary phase. Secondary phase usually occurs 6 to 10 weeks after the appearance of primary lesions. The secondary phase is also known as your dissemination phase. This is where your spirochetes from your localized lymphadenopathy, from your localized lymph nodes, they enter your bloodstream, and from the bloodstream they can go to many organs. However, they will enter. However, in the bloodstream, they will lodge itself into the arteries, into the capillaries and the small arteries, and they will cause rashes. These rashes will mostly be on the trunk. You will have generalized lymphadenopathy because the bacteria will move into the lymph nodes in your whole body. We have condylomata. These are basically warts in the moist areas of your body. So that would be your perianal region and your mucous membranes. And also you will have with that your constitutional symptoms due to sepsis. Your constitutional symptoms include fever, sore throat, malaise, and arthralgia. Then we will have our latent phase. So as I've said, there are two forms of latent phase. We have your early latent phase and we have your late latent phase. In your early latent phase, it occurs less than a year. So in your early latent phase, your spirochetes will be circulating within the bloodstream, thus leading to symptoms of your secondary phase. However, this will be occurring less than a year from your primary infection. So let's say this is your timeline, this is your moment of primary infection, you got your secondary infection after 3 weeks at this point, and your early latent phase will occur somewhere here, and your late latent phase will occur here. So the time limit from your secondary latent phase to your primary infection is 1 year. However, the time from your secondary infection is mostly more than 1 year. In your late latent phase, it mostly occurs more than 1 year, and your spirochetes they mostly localize into your organs. Therefore, you will not find any symptoms of secondary phase. However, you will be asymptomatic in this area. The tertiary phase occurs after 1 year from your initial date of infection. And your treponema bacteria, pallidum bacteria, it affects a multiple array of organs that includes your spinal cord, your brain, your eyes, your heart, and you have a immune mediated reaction. So when your spinal cord is affected, it mostly affects your dorsal column, and when your dorsal column is affected, you mostly lose a sense of vibration, proprioception, and you have signs of paralysis. While when your ventral column is affected, you lose sense of temperature, pressure, crude touch, and pain. When the treponema pallidum bacteria affects your brain, you mostly have symptoms of headaches, slurred speech, and paralysis. So when the treponema pallidum bacteria affects your eye, you have something called the Argyll-Robertson pupil, where the pupil loses its light reflex. However, it does not lose its accommodation reflex. When the T. pallidum bacteria affects the heart, it mostly affects the aortic arch, where it causes aortitis. Also, it causes aortic regurgitation and aortic aneurysms. There is a histological feature that is known as a gamma. A gamma is basically a collection of your antibodies. So what happens here is your antibodies get so excited to defeat this syphilis bacteria is they start to clump against themselves, and in many conditions there turns out to be no bacteria within these clumps. So let's move on to the diagnosis. The gold standard in Fiji is through dark field microscopy. This is an example of a dark field microscopy. As you can see, it makes the visualization of the T. pallidum bacteria quite easy. Also, the international community uses serological testing of the blood and CSF, reactive testing with non-treponemal antigen, and palladium polymerase chain reaction. Let's move on to the treatment. So the treatment of early syphilis, that is your primary, secondary, and early latent phases, is to benzathine penicillin G 2.4 million units intramuscular single dose. However, if you are allergic to penicillin, which a large majority of the population they are, then you can use your doxycycline 100 milligrams twice daily for 14 days. However, when we deliver our injection of penicillin or doxycycline when the patient is in its primary phase, we will have a reaction that is called the Jaharis reaction. And in this reaction, basically your patient will have a mild fever, malaise, headache that mostly lasts up to several hours. The JRS reaction is mostly due to the sudden release of cytokines in the body. The treatment of the latent phase, we mostly use benzathine penicillin G 2.4 million units intramuscular, 3 doses at weekly intervals. And if you're allergic to penicillin, you can use doxycycline 100 milligrams twice daily for 28 days. When you have neurosyphilis, that is when the Treponema pallidum bacteria affects your eyes, spinal cord, and your brain, then we mostly use the procaine penicillin 2.4 million units intramuscular daily plus probenecid 500 milligrams orally 4 times daily for 14 days. And if you are allergic to penicillin, then we mostly give doxycycline 200 milligrams twice daily for 28 days. With that, I would like to thank you for listening to my small presentation.